Welcome to another episode of Well To Do. It's all about having abundance in health and wellness and love. Are you well to do? Well, if not, this show is going to make you feel a little bit more inspired about how to have regenerative medicine in your life so that you can avoid any kind of, cosmetic surgery or some kind of aesthetic issue. But if that's something that you really do want to go down a path in having cosmetic surgery to make you feel better, then I have finally found the best person to interview in this space. And that's because he's really into regenerative medicine and not just plastic surgery. And without any further ado, let's welcome our guest, Dr. Cameron Chesnut.
Thank you for having me.
You are a fantastic plastic surgeon. I've been watching your work and the following for a really long time on Instagram. And I must say that what is inspiring about your work is not that you get the results and you have your own, is it a trademarked Enigmalift?
Correct, yes.
And so that's a big secret. And people are like, what? So we're going to go into that, right? But also because you do have a natural passion and flair for health education. So there aren't many doctors around that are chosen to be plastic surgeons that want to help us learn about our health, right? Tell me what made you get into the field. Dial it right back, because plastic surgery is something that everyone's doing. Mm-hmm. But is it our last resort, or tell me?
Yeah, I mean, my journey to this stems quite truly from childhood. My mom was a nutritionist, and I was very interested in nutrition and health and wellness and things like that, even as a kid, mostly for sports performance. That's what really drove me when I was young.
Okay.
And that was my major in college. I was a nutrition major, and I thought maybe I would do something with that with my life, but I knew medicine was always there. And as I got into medicine, I went down the traditional paths of you got test, and got to do this and got to do that. And as it got time to choose a specialty, I knew that I really liked reconstructive, three-dimensional spatial types of things. Got back to like my artistic roots as a child a little bit. But at some point along that journey, I also realized that I wasn't doing or using any of the things that I was passionate about as a child, as an athlete. I was still an athlete at that point, and I was doing them, but they were such separate parts of my lives. And I realized that I wanted to do them together in medicine. So honestly, I could have done anything. I could have done orthopedics, and I would be doing this as well. Yeah. And so the plastics came just from a love of reconstruction and three-dimensional types of creation. And then the love for regenerative medicine stemmed from nutrition turning into longevity and wellness and all the ways that it can make you better. And to me now, they're inseparable, because I'm doing elective surgery, and the ability for baseline nutrition and inflammatory status and oxidative status to help us heal from these elective procedures is undeniable.
Right.
And so it just makes everything better.
You're really fast tracking that person's healing. That is unbelievable, witnessing those results. Like when you say this person came in after X amount of time, and I'm like, what? Like it just doesn't feel real.
Yeah.
Because you expect to see so much more bruising and swelling, and just the person's still quite vitalistic.
Right. And it starts before they come. That's another part of the whole equation, is that I going back to the athlete's mindset, I've always prepared myself like an athlete. Right. I have a preparation, I have a game day ritual, and then I have a recovery. And I do the same for my patients. And I kind of have this interesting thing where, if an elite athlete was going to have an injury on a specific day, we knew the day that it was going to happen. Mm-hmm. They would have a very specific preparation leading into that. But people aren't really using that for surgery, and I do.
Yeah.
And I have them, months before they come, starting to get optimized in their health.
Well, it totally makes sense to do that.
Yeah, everything is primed on the day that we go.
Actually, I talked about this in my book, Treasured Chest, before I got prepared to have the explant surgery. And I kind of engineered my own, fast tracking the recovery, which started before, because I had conversations with my anaesthetist, having had MCAS, or mast cell activation syndrome, as a result of the BII. I knew that I may not react well. And so he was like, oh, I'm going to microdose you. I know exactly what I want to do. And then I kind of took it one step further. Instead of sitting there in the hospital room staring at the news screens with bad news and everything, I was like, I don't want this to be my last thing going under. So I saw there was a prayer room behind me and it was empty and no one's using that. And I was like, oh, I'm going to do my yoga. I'm going to do some breathing because I know my body's going to be sedentary for a really long time. So let's give my body some movement and all of that sort of thing. So I guess my spirit knew that it needed to do something well or good to have a great outcome, right?
Right. It's anything we do in life, it's better to go in knowing that you prepared for it. And this is no different.
So if we can just talk a little bit about, I guess, the fact that you are doing facelifts. I don't think we've actually just blanket statement said it yet, but you're doing these incredible facelifts. And really, I guess you're so meticulous in it. We're going to go into why I think that, and then I'd love to learn more. But I just want to say to my audience that everyone is beautiful just the way you are. I really believe that wholeheartedly, right? And I wanted to sort of deep dive into the fact that people are making mistakes by using injectables, threads, all kinds of things that are like scarring their skin or making your work difficult when you do have to go in there and sort of repair. It's not like it's a botched thing, but it's actually kind of, I guess, aging them when they think they're actually doing the anti-aging, right?
Yeah. Yeah.
So let's talk about your top mistakes that people are making before they come in.
Well, so I get to see this from all over, and this has been an interesting thing. My patients travel in from all over the United States and all over the world, and I get to talk to a bunch of them before they come. And when they come, I'm with them for a week. We get very tight relationships, but before that, I get to talk to a lot of people. And so there are a few themes that I see very, very frequently happening worldwide. This isn't even just in the US, but the biggest one of them is hyaluronic acid fillers, very specifically. And I've seen that change over the past decade. But that is the one I would say mistake. And I shouldn't say that because they're not bad. And the people that inject them aren't bad, but they're just wildly misunderstood. And there's a lot of flawed logic with how they're utilized. And I see people who get distorted. They get inflamed in their face or wherever the filler is. And when I bring this up to them, they know, oh yeah, I did notice that inflammation. I just didn't know what it was from.
Right.
And then they end up lasting decades when they're told that they're going to last 6 months, 12 months or something like that. And then there's this idea that there's a magic eraser, the enzyme to dissolve them. And so you have, which is not true.
Right.
The enzyme can help, but it does not just magic. It's not a get out of jail free card. It doesn't get rid of them like a magic wand. And so you have this product that only lasts 6 months. It's harmless. If you don't like it, you get it dissolved. And none of those things end up being true.
Wow.
And it also contributes to this model of, well, if it only lasts 6 months, that means come back in 6 more months and we'll put more in.
The forever customer.
Right. And so there's a financial model to it a little bit too. But I actually think that most of it is a misunderstanding, less financially driven. And people end up getting, I've had filler 10 times, and that's not an uncommon thing for me to hear. And it's essentially a semi-permanent implant that they've gotten 10 times over and over.
That's interesting that you say that because implants, there's new data to support that implants are indeed an inflammatory driver and they create a cytokine storm or an inflammatory response, inflammation. And that's what we're talking about. And it's a foreign body within the body, essentially, isn't it? Causing the MCAS, the mast cells, to start attacking each other because they know that shouldn't be in there, right?
Yeah, and it is similar to breast implant illness. I haven't heard a lot of people talk about this. This is probably the first time I'm talking about it because I'm certainly no expert in breast implant illness. I'm facial plastics only. But when we think about the mechanism of a foreign body, the filler is no different, and the surface area matters of the filler. And it, 10 years later, I'll see somebody who had a cold, or they had just an allergic reaction, or they had their teeth cleaned, and the filler that's in their cheeks puffs up, gets red, gets warm, and I bring this up and oh yeah, that does happen to me. Or we heard a lot about it during the COVID vaccines when this made news, where people that were getting the vaccine, their filler was lighting up because a systemic inflammatory response gets localized to this filler.
And perhaps the adjuvants within it as well,
Absolutely.
creating that inflammatory response. Well, I'm no expert in that, and I don't want to have an opinion on that very debated topic.
Right.
But I do know that it's a foreign body within the body. So this is a kind of a no.
Right.
Also, my audience know, and if they don't, and you're new to watching my platforms and things like that, I don't advocate injectables. I don't want you to have Botox or fillers if that's something you can avoid. I want you to know that we want expression in your face. We actually want those muscles not to be paralyzed, and that's what Botox is. It's paralysis, right?
Yeah, and so I get crucified in my specialty when I talk about this sometimes from the injector population, all of the neuromodulators like Botox, botulinum toxins, are intended to paralyze muscles. The nuance here that many will argue is that it doesn't completely immobilize them necessarily, and if they're completely immobilized, it's been a bad job, bad Botox if you can't move at all. But I definitely, and I've talked about this, where I believe that our face is meant for purpose, right? And so I'm trying to restore function and form when I'm doing what I'm doing. And our main purpose of our face is to emote, communicate.
Right.
And Botox does take some of that away. I don't think it's entirely bad. It's not it's just, we need to think about the root. What are we shooting at here? We're trying to take away muscles that are wildly important to what makes us human. And so there's other ways to go around that equation. This is an interesting, I think, idea is that the reason that we want to immobilize the muscle or weaken the muscle is because it's pulling on our skin. And the only bad thing about that muscle pulling on our skin is that as our skin gets weaker with time, it breaks down from the repeated movement. Well, what if we just go make the skin stronger, regenerate it? Then we don't have to worry as much about what the muscle is doing to the skin, and you can have full facial expression, not have to worry about that as much. So it's not all bad, but there's two parts to the equation. There's two levers we can pull, if you will. And so I just like to think about it that way.
Interesting. So, and then we have like threads, for example, another inflammatory driver because it's a foreign body within the body.
Right.
What if they're dissolvable threads? I mean, I haven't done that, but in fact, I'm curious about having a facelift at some point. This is like, whoa, my audience are like, oh, but if I was going to advocate something, I would advocate the work you do because it's one and done. And hopefully, we regenerate a lot faster. But threads, what problematic issue could it be?
Threads have gone through a big evolution over time from being permanent threads like the foreign body to being dissolving threads. The biggest issue with them is that they just don't work well. And that's where the rubber meets the road, really. So you're spending money, you're taking risk because there is risk to them, and you're not really getting a result. Because what the threads are intending to do is move a fat pad back to an area where it was before. But that fat pad is still fixed deep, and it has gravitational forces on it that the thread's not able to, overcome. There are issues and risks with threads, and every one of my surgical colleagues has seen these and struggled with what threads have done to the tissue underneath, because there can be inflammatory changes, there can be scarring, they can be in the wrong location.
For those who also don't even know what threads are, let's just quickly tell them.
That's a great idea. So a thread is an idea of putting a suture or a thread under your skin to provide a lift. It would be akin to like putting your fingers on your face and lifting
and then
up.
Pulling it up.
Yeah, pulling it up.
Like a fishing hook.
Right.
Inside.
Yeah, exactly. And the problem with that being that it's hard to get the purchase or the tissue to lift appropriately.
With it, yeah.
And if it does, then the thread is doing something to be grabbing, and we can just imagine that that's not a great option under there. Then the other thing is, if threads did work, the population that is generally seeking them is not the ones who should have them. If you are, let's say, 65 years old and have some redundant skin, face, fat pads, and you're getting a lifting procedure, the extra skin that's created has to be addressed, has to be redistributed, has to go somewhere. So it can look very, very unnatural.
Yeah, that's so interesting. But let's go back to regenerative medicine and prevention, really, because I am 52. And a lot of people are shocked when I tell them because I haven't needed to do anything yet. And honestly, nobody needs to do anything anytime, right? But I just want people to know that you can actually age well if you give your body the right environment to do so.
Absolutely.
So, I mean, I wrote about it in my books. This is my whole life's work and passion and ethos, and, I'm testament. But some of the things you talk about, which I'm very drawn to and interested in, are some of the practices that I've been talking about as well to my clients. And they can be things like, purging toxins in saunas or moving your body underwater with weights. Let's go through some of your favorite things. And the reason why I'm saying that's important, and from a face perspective,
Right.
is that if your entire body has tone, it's because you're a product. This is the byproduct of being well. So people can go, oh, why does your face look so young, Andy? It was like, well, have you seen my whole body? Like, it's not just my face. It's the fact that I am aging well because of the practices. So tell me about some of the practices that you get people to start to do before and then after their surgery.
Yeah, I mean, it's interesting because when somebody asks me, like, what would you tell someone in their 30s to do? It's really boring stuff, and it really turns a lot of the cosmetic seeking folks away often because it is you should be eating whole foods, you should be exercising regularly, you should be sleeping well, and that is so boring.
Basic.
They want a magic bullet, a quick fix, you
Yeah.
know. And that doesn't exist because our facial aging, and this is replicable, our facial aging is a reflection of our internal health and genetic health and metabolic aging. And
Right.
so when you look at a metabolic aging curve, when you look at a genetic aging like epigenetics, you can get a pretty good prediction of what somebody's face is going to look like with just this objective data.
Right.
And that's interesting, right? Because those are levers we can pull. Those are things we can change. And it's a long game. Doing it, you know, the best prevention early on is systemic because the same elastin that breaks down in our skin is the elastin that breaks down in our arteries, right?
Yeah.
And there's differences. Our skin has sun exposure and things like that. But in a sense, you know, the internal milieu is going to drive how we're aging in our face.
And the bone health.
Yeah, we can
the
just
muscles
see
that
our
sit on the
face. We can
bones.
just see our face. All the other tissues, you can't see inside of your arteries or what's happening with your bones quite as much. It's just such an obvious reflection of your internal health, which is why you look great at 52.
Thank you. But also your internal mindset.
Oh, yeah.
Like we wear what we've been through. So on that note, you know, our faces do tell the stories.
Yeah.
And I think that's why it's really important that with your Enigmalift, it really doesn't change the person's way that they were born when it's
Right.
finished. It really just kind of restores who they perhaps used to be. And it hasn't really given them the cat eyes and all of those things, which is crucial. But, you know, we were talking about even how the Botox, the paralysis doesn't allow freedom of expression. I always think about, you know, if you have a baby and your baby can't read your face, you know, what's that relationship and communication like? And the same with a partner. If your face is frozen and you can't read that partner, like how deep really is that understanding on an emotional level? So remembering that, bringing it back to wanting to look your true you. Tell me what you think with your obsession with, you know, you said 5D sort of studying and all that. Like even when we met, I could see you were totally studying my face immediately, like what you could do because it's who you are. Do you know what I mean?
Yeah.
It's like when I look at somebody's spine, I go, oh, they've got a scoliosis or, you know, I can see a pelvic tilt there or whatever because I've been a chiropractor's assistant for 20 years or whatever. So I look at those things because I'm obsessed with it. Now, you're practicing of the art and discipline of Brazilian Jiu-Jitsu.
Yes, absolutely.
Now, I'm bringing this into your work as a surgeon because I've also studied BJJ. And the theory is that when you have your opponent, you control in a really sort of slow way. And you feel like you have that control in a very calm way before you make a submission or an attack.
Correct.
And that kind of studying and staying calm, I think it's how you do anything, is how you do everything.
Yes, absolutely.
So do you think that mindset from BJJ comes into the surgical room?
Oh, 100%. Yeah, the BJJ is also being uncomfortable or learning how to be comfortable in uncomfortable situations. You're purposefully putting yourself there, how to not panic, how to get out of things. Because it's not all about submitting. Sometimes it's about not getting submitted, right?
Yeah, that was my first comp.
Yeah.
I won just from not tapping out for 6 minutes.
Yep. And so
remember that.
I definitely carry that in. It's the, you know, the hardest thing you do every day. You get to choose what that is often. And so
Yeah.
for me on those days, that's what it is. And it's a mindset of performance and it's a mindset of learning something new and, you know, where I have a strong mastery over my surgical world. This is kind of going back to, it's a white belt mentality. We call it that, always stay curious. And so it helps me in all of those things, but really it's about, you know, if you can stay calm in some of those situations that you're electively putting yourself in, it really, really helps in the operating room. It would be no different, just on a different scale, than like getting in an ice bath voluntarily, which there's
Right.
physiologic benefits and then there's cognitive
Right.
benefits. And one of them is you've chosen to do something difficult, and can you, get through it? Can you, improve your cognition through it? Which was why we know that it helps with things like anxiety disorders, because now you've chosen to do something difficult and you're dealing with it.
Yeah, because you're in this difficult situation because you open up the person, you don't know what you're going to get, right? Like,
Yeah.
what did the threads do, and what have we
Hmm.
found here? You've found some funky stuff, right? What
Oh
have you
yeah.
found?
Yeah, and a lot of my procedures are revision or fixing something at least, and so there is a little bit of choosing your own adventure. You don't know exactly what you're going to
I
find.
love those books.
Yeah, because I am very again, back to the athlete's mindset, I'm very big on visualizing. So by the time I am seeing somebody for surgery, I have visualized through every potential aspect of their surgery in multiple ways, depending on what I'm going to come to. But there's the occasion where I just don't know. Like if it's a revision, I don't exactly know what the previous surgeon did. And in those situations, I'm just prepared for anything.
Yeah.
Going into every surgery, I'm also as optimized as I can be that day. What I was eating, sleeping,
Yeah.
no alcohol, just being at my peak performance for that particular
Yeah.
surgery, which seems like a no-brainer, but is absolutely not the norm
Oh,
for
so
any
many.
surgeon, let alone something like what I'm doing.
Yeah, I mean, most people don't realize how committed you are to your own health so that you can be that better person for them in practice,
Right.
because so many surgeons really don't look after themselves. So that's definitely an admirable quality. You came up with this trademarked Enigmalift. It's
Right.
such a mystery. And I still can't understand why there is no scar. So it's a scarless procedure. And you're saying that it comes from just this sort of upper eyebrow temple area, the back behind the hair.
Yeah.
And is it on both sides? Is it just one side?
Yeah, so the real truth of the Enigma lift, that where that name came from, it actually came from patients over time who were kind of telling me, somebody at one point early in my career said, it's like an enigma. Like, I know that it happened, but I can't understand it or know where it was. And so the Enigma lift procedures actually is a spectrum of things, and they are aimed with that same mindset. It's more of a mindset that, like, let's do as much as we can with as little as possible. The Pareto principle, the 80-20 rule. Let's make as much impact with as little evidence that we were there, and that carries into all types of procedures, whether it's eyes or upper lids or lower lids or brows or faces. And there are certain situations, yeah, where there can be no visible scars from it whatsoever. And we can
But I
have
still don't
incredible results.
understand. Like, so it's just one opening here,
Yep.
or
Yeah. On
that's
each
it. How do you
side.
do the whole face just from one?
That's the technical challenge, right? That's for me that's where I get into, how do I access the deep plane, which is a
Right.
big facelift buzzword. How do I get into the deep plane properly and get the release that I do? And, I approach it from this mindset of thinking about the different layers of our face. And we have our skin, which is a great first place to look. It's what everybody sees. It's an easy access to make it better. And it's non-surgical usually to do that. Almost every surgery that I do, I'm mixing with strong non-surgical procedures as well. Lasers or stem cell rich fat.
Wait. Stem cell. Where are we putting those? The fat.
Yeah. So the fat, so when I get to the fat pads, right, of our face, that's
Where's
sort of
that
the middle layer.
for the
So,
average person?
so they are underneath the skin. So we have skin, we have fat and fat pads, and we have some muscles, and we have some other fat pads deep down. So again, thinking about the function of our face, the real function of the fat pads is to become glide planes so that the muscles that we talked about earlier are able to do their job. And as the fat pads change, lose their projection, lose their shape, not only do we get the aging changes that we all know, but we also change the way that our muscles function. So when I'm thinking about rejuvenating a fat pad, I'm also thinking about its effect on its actual physical purpose, which is to make the muscle work properly. So there's more to it than just looking good afterwards. It's functioning better, like making somebody smile better after I'm doing a procedure on their face, because now the muscle's back in its, working vectors. And so when I really think about each fat pad individually, and if I could, Reader's Digest, boil down my mindset when I'm in there is, okay, where is this fat pad now? Where did it used to be? How do I get it back there? And then once it's back there, how do I get it appropriately volumized and structural? And so when we think about any fat pad, it doesn't just shrink in volume, it also changes position and changes orientation.
Wow.
All of our fat pads, breasts, facial fat
Yep.
pads, they all do that. So it's not just about adding volume back to it, which is what an implant or filler does. It just
Right.
adds volume to aging tissue. That's not often a good answer.
Right.
We want to put it back, shape it properly, and make it project. And so I'm going through fat pad by fat pad and doing that. And one of my tools for that is stem cell rich fat. So I take your own fat and I use it in your fat pad to replace what's lost and to make it more structural
Wow.
again.
So that's so good because it's not somebody else's DNA, which kind of freaks me out.
Yeah, yeah, yeah. Staying autologous, like from you, is
Yeah.
powerful in a lot of ways because it's all the sort of right growth factors or the right stem cells that you need to kind of heal.
And do not fat pads, the fat stem cells, fat-rich stem cells, do they migrate into other areas in the way that other things
Yeah,
migrate?
great question. Because filler migrates, that's one of the things that it
Yes.
does. And it's interesting in that world where it was denied for a long time. People said it didn't migrate, and now people are starting to embrace that it migrates as a positive thing. So that's a fun and interesting thing. But in contrast, fat does not migrate. And it cannot migrate for one very simple fact is that when I put the fat in, it has to establish a blood supply to survive. Once it's established its blood supply, it is fixed. It cannot go anywhere else. It can't move, can't migrate. It lives there permanently.
Interesting.
Yeah.
Interesting, because one of the things with breast implant illness is that, you get all this bacteria and infection and everything because the implant doesn't have the blood supply.
Correct.
So, oh my goodness, this
Yeah.
is really mind-blowing. So, but you've opened up somebody, I think you said that you saw some of the filler migrate to other areas. Like,
Yeah.
how scary? Was it just like splotching all over the face?
I see it in all kinds of different ways. Yeah. Depending on the plane that it was put in, the three-dimensional physical plane that it was, or what types of tissue. I see it in muscle. I see it in fat pads. Sometimes I see it back behind the eye.
Goodness. Can you get it
inadvertently.
out?
Yeah, but interestingly, in a lot of those situations, when I go to get it, I have videos of this on my Instagram that people can see just to kind of for educational purposes, see what it looks like.
Yeah.
But a lot of times when I go to get the filler out, it's encapsulated like a breast implant would be. Our body
So
is
the
sort of
body's walling it off.
Yeah, and I'll pull out this, sort of little gelatinous implant, and when I push on it, nothing happens. But if I, poke it with a scalpel, then squeeze it, then the filler comes out.
Stop it.
Yeah, so it encapsulates.
I think I'm obsessed with a whole new watching of that.
Oh yeah.
No, because obviously I've become an expert in the BII and I love it when they open up the capsule and pull out the implant and I'm like,
right.
what did we get?
Very
Was
similar.
it ruptured? But it's tiny, right?
Very small, yeah, small version, like pea-sized.
Yeah.
But there's other times that I find filler, and it's just like I would describe it as like wet sugar in the tissue that I'm working in the underneath the eye, often somewhere like that. And so it doesn't always encapsulate. I think it depends on where it's placed and the person's immune status and all kinds of things dictate what happens with it. But I've seen lots and lots with it.
So, Dr. Chesnut, I've been like asking you, but what if I want to do these laser burning things and the topical things? And you're like, no, and no, and no. So,
Yeah.
but tell me why, because obviously we're just creating, and I haven't done any of this yet, but we're creating this like superficial, scarring, if you like. And the theory is that you create trauma and then you want the body to then go in and heal it and produce more collagen, but it's such a surface level thing. Is that right?
Yeah. So, my whole practice is regenerative or restorative. I'm not doing anything transformative. So something like a breast augmentation or even a nose job like a rhinoplasty would be changing something from the way that it is now to something that never existed before. And I only say this to say that all of my practice is about trying to take things back to where they used to be, nothing different than how it ever was. And our skin is a prime example of that because we were all 19 one time and had, our perfect skin or whatever it may have been that was really strong and resilient. And then we get the changes that happen in it. And those changes happen from exogenous things like sun and, and exposures from toxins, pollution, whatever exterior. But then we have a lot of interior changes as well. So our skin kind of gets a double insult. So does our gut. And they're strongly linked together as opposed to some of our other tissues and how they age. But if we can go figure out the changes that are happening there and then work to turn those particular things around, which is primarily changes in elastin and collagen. Collagen is the one that everybody talks about. It's hot, it's sexy.
But what about exogenous collagen? Is that just ridiculous?
Well, yes and no. I think that people think that you're going to drink collagen and it's just going to go through your gut and right to your skin. And we know that that's not how it works. When we eat a protein, it's broken down into amino acids and then they cross over and then they get reassembled, right? So, but there are, interestingly, studies showing that taking collagen supplements improves the skin. So there's been this missing link in there a little bit. And we're starting to find maybe some of the answers in sort of how the collagen epigenetics affects like DNA regulation, right? And that may be what was been missing the whole time. So collagen supplements aren't great for maybe building muscle as a protein source, but they are a protein. Collagen's missing one essential amino acid to make it a complete protein. It's missing tryptophan, but we know that taking a collagen supplement, bone broth, whatever it's going to be, is going to have some benefit on your skin health, probably beyond just the amino acid profile that it provides you.
I mean, from the mere fact that it's going to I guess, line the stomach well again, like repair the tissue, because collagen repairs tissue and the stomach lining is a tissue. Now we have proper assimilation of nutrition, right? And that's what builds wellness and vitality, right?
Yeah, you need the building blocks that are there. And then we're learning, I think, what those building blocks do outside of just, physically being present to be reassembled. And elastin, the other one that I mentioned, is probably the more important of them versus collagen. Collagen's talked about all the time. Collagen's the structural strength. It's the rebar of our skin. But elastin, as the name would suggest, is what gives skin recoil. And it's a delicate flower. It's easily damaged by UV exposure, and it doesn't like oxidative environments very well. So it breaks down quite easily, and it's hard to rebuild it. So a lot of what we're doing is really trying to restore elastin tissue, because restoring collagen is, in some sense, kind of easy. If you scar or injure the skin, that scar is collagen, but it doesn't have any elastin tissue, doesn't have normal blood vessels. So we're trying to go in the route of regenerating the skin, turning on the repair mechanisms, and then sort of helping or manipulating them, regenerating them to make more proper blood vessels, more elastin, more collagen. And that's where something like microneedling comes in. Super easy entry-level baseline thing to do, especially if you're using it with something regenerative like PRP or exosomes.
So is that good?
Yes.
So people should do PRP microneedling before.
I would say super easy, highly likely to help, low downtime. It's great. You just have to have realistic expectations, what's it going to do for you? If you get to a point where you have changes that you see that you're like, I want these to go away. I have wrinkles. Microneedling's probably not going to get rid of those.
Yeah. It's more of a preventative.
Yeah,
thing.
exactly.
Yeah.
If you're 30s, 40s and you're doing it, like, great, you're going to help, preserve your prime there a little bit. At some point, though, that's where like a laser resurfacing comes in. And that's a great first place to think about getting into non-surgical things that actually move the needle. Like, it's a real improvement. It's durable, it's long-term, and it's just your skin, making your skin better. Mm-hmm. That comes in a lot of different flavors, a lot of different ways, but that would be a great first place to look.
Okay.
Non-surgical does really well. And I'm using a laser, I call it a laser cocktail, because it's usually a few different lasers that I'm using.
Do you actually do things to your face?
I've done lasers before.
Wow.
Not
I just
for a
thought it was
long time.
all internal vitality.
Yeah. I haven't done a laser for probably 5 or 7 years, but yeah, here and there I'll do things.
I don't think you need anything just yet, because you're such a healthy person.
Thanks. Working that way.
Yeah, and also like your actual environment, your geographical environment. So you encourage people to stay there when they're having in your, what's it called? What's WA stand for? I'm such an Aussie.
Washington.
Washington.
Yeah, not Western Australia. Yeah.
It's not Western Australia.
Not in Perth.
My mind immediately went there as an Aussie.
Yeah.
But so people come to Washington to see you practice. That's where you practice. And then you encourage that they stay there for all the regeneration. Yeah. And it's an absolutely beautiful place in the world, isn't it?
Yeah, it is. And the way that it works when patients come is my practice is in Washington and Idaho, which are right on the border from one another. So I live in a town called Coeur d'Alene, Idaho, which is a little lake retreat. And we have homes that are curated for that. They're EMF protected, grounded floors, all the lighting is proper.
Really?
They're views of the water with fractal patterns, and it's all shaped around healing. That's the whole idea. So you come and you have this experience where you're in this recovery home that's, curated for you. You stay there for about a week afterwards. Every single day you're coming in for your modalities and healing. That's hyperbarics and PEMF and red light and targeted IV nutrition and all these types of things that go along with that. But it's almost like a wellness retreat experience going through that.
Yeah, that's amazing. And hopefully that rubs off on the patient and they eventually, put that into their life, because most people that come to you don't actually have a wellness lifestyle. Like, they're just like, fix me, I haven't done anything up until now, and now I'm interested in wellness, right? So hopefully it rubs off.
Yeah, I've seen a lot more of a change, and it's probably a sampling error a little bit based off of my own personal, loves and preferences, but I see a lot more patients who are coming to me in a pretty good spot, who I like to get, before somebody comes for any surgery, a surgeon might check a couple of key little labs, right? Well, I like to get a little bit more comprehensive, almost like a functional medicine type of panel. Yeah. And I actually have a team that helps me do that, functional medicine team. And they are getting into micronutrient, deficiencies and things that help me when I'm designing the recovery protocol to be super customized. So you are a poor methylator of B vitamins. Well, great. Now we know that we can change your IV to compensate for that a little bit. And so,
Root cause stuff.
yeah, those things get taken out for sure, or discovering that somebody's maybe a little insulin resistant early on, and these interesting changes that can carry with.
You see, you guys, this is why we brought Dr. Cameron Chesnut on the show, because he is very holistic and very knowledgeable in his entire practice.
Thank you.
And I wanted to give you a gift as well from Aries. It's the Life Tune Flex. It's a key ring for your...
Love it.
Yeah. It's going to help with EMF protection. If anyone else wants to learn more about that kind of thing, please go to Aries' website. And also Andi30, ANDI30 is your code to get a discount, 30% off for yourself. I am absolutely so grateful that you got to be in LA to do the show, because I only do them in person. It was just such a coincidence that you were here and you could do it. So thank you for making the time.
Absolutely. Thanks for having me.
Yeah. And could you tell everyone where we can find you?
Yeah, I'm active on all the socials, but Instagram is the main one. That's the best place to go look.
So what's your Instagram handle?
Instagram is Chesnut with no T in the middle, Chesnut, chesnut.md. I spell it different than the real nut.
Excellent. And he's definitely a health nut. So
Yep, absolutely. There you go.
That's our episode of Well To Do, you guys. I really hope you found that very educational. I did. I'm inspired to take care of myself a little bit more and then look for the right type of surgeon, yeah? So if you loved this information, leave a comment. Tell us what you loved about it and share it with a friend. You're watching and listening to Well To Do. Thank you.
Yes, thank you.